This presentation will focus on the Ottawa Charter for Health Promotion. The 5 action areas include 1. Developing personal skills, 2. Creating supportive environments, 3. Strengthening community actions, 4. Reorienting health services, and 5. Building healthy public policy. To help you to remember these action areas, it's important that you come up with an acronym, because these action areas are very important not only for the preliminary course but also for the HSC course. We'll begin by looking at Action Area 1, Developing Personal Skills. Developing personal skills is all about developing the skills, creating the opportunities for people to develop their knowledge and their understanding so that they can make healthier decisions in relation to their health. A great example of a strategy that develops the personal skills of individuals is Quitline, which is part of the National Tobacco Campaign. When people call 131 848, they're able to speak to an expert who's able to give them advice, strategies, and ideas to help them to quit smoking. This is a great example of developing personal skills, because with that knowledge, a person is able to take greater control over their decision making and apply the skills that they've learned. There are various other examples of strategies that develop personal skills. Another example is the Slip, Slop, Slap, Seek and Slide campaign, which provides people with the key skills and strategies that they need to be able to protect themselves from the sun. This empowers young people to make safe decisions. Similarly, the Speed Advisor app, which can be downloaded from the App Store, advises drivers when they're entering a particular speed zone. It will tell them when they're speeding over the limit and encourages the driver to slow down. This allows the driver to develop their skills of the various speed zones and encourages them to change their behaviour and take control. The My Quit Buddy app is another example of a strategy that develops personal skills. It's a free download at the App Store, and it can provide lots of information and opportunities for a smoker to engage with opportunities to quit and set goals for themselves. Moving on to creating supportive environments. Creating supportive environments is all about providing environments for individuals that support good health. So it's the responsibility of governments, communities, schools, employers and families to provide supportive environments, or environments that support healthy decision making. So for example, in the school environment, a supportive environment would be providing shady areas for young people to move out of the sun to avoid exposure to the sun, and also providing a canteen that is healthy and provides healthy choices, and a school counsellor that can allow young people to speak to someone when they're in need. All of these strategies provide a supportive environment for young people. Some other strategies that create supportive environments include the promotion of smoke-free messages, non-smoking areas, for example in public places, frightening media campaigns that create a supportive environment for people to quit, the promotion of pharmaceutical products such as nicotine patches, which creates a supportive environment for people to quit, and also advertisements in different languages. So healthy canteens provide supportive environments because young people have a choice, and when they're presented with a healthy choice at a school canteen, that is a supportive environment for them in terms of their food habits. We also have the various speed zones on the road that create a supportive environment for drivers. When they see the speed signs, they tend to slow down, and this is a supportive environment that encourages safe decision making. As mentioned, the culturally and linguistically diverse advertisements create a supportive environment. For those people that don't speak English, seeing the advertisement in the language that they can understand is supportive for those people and encourages them to make a healthy choice or decision. Moving on to strengthening community action. Strengthening community action is about empowering the community to take action. It's about communities having greater ownership of decision making, providing access to funding, providing representation at all levels of government, providing the opportunity for the community to learn, It works on the premise that if the community develops the strategy, the community will respond better and will obviously receive better health outcomes because they've played a role in developing the strategy. Fatality Free Friday is a good example of strengthening community action because in this health promotion initiative, members of the community are encouraged to reflect on their own driver behaviour and take the pledge to drive safely. In essence, they are making a commitment to be a safe driver, and this gets the community involved. The National Aboriginal Community Controlled Health Organisation provides an opportunity for Indigenous communities to deliver their own healthcare to their communities. This is very, very important because Indigenous people have a holistic perception of health, and so that's a little bit different to the rest of the community. So for Indigenous people to reach their potential in terms of their health, it's very important that members of their own community have a big say in how or the direction in which health should go. So this is a great example of strengthening community action. Another example of strengthening community action in the area of road safety, this opportunity to identify a location for a speed camera encourages members of the community to come forward and suggest places where speed cameras should be. This is a great example of empowering the community to have their say. Moving on to reorienting health services. Reorienting health services is all about changing the focus of health services. Traditionally, health services such as GPs have taken a curative approach rather than a preventative approach, and the Ottawa Charter for Health Promotion acknowledged that for the health of everyone to improve, health services must take a preventative approach, and health promotion should also be shared across a number of sectors. For example, non-government organisations, government agencies, businesses should all play a role in health promotion. It shouldn't just be the government that encourages people to make healthy decisions. So reorient just means to change the focus or direction, and in this case, change the focus or direction of health services. So prevention is better than cure. Health should be viewed as a holistic concept that is influenced by a number of factors, including the determinants of health, sociocultural, socioeconomic, and environmental. Reorienting health services also focuses on the research and training for health professionals required to ensure that they can deliver a preventative approach. But more importantly, it's about partnerships. It's about sharing the responsibility for health promotion amongst individuals, community groups, health professionals, health service institutions, and governments. So a great example of reorienting health services is the refocus of the role of GPs as promoters of health rather than just curers of diseases and illnesses. The B Street Smart Forum is another example of reorienting health services because it actually brings in the expertise of a number of different sectors in the community. For example, you can see that there are a number of government organisations, non-government organisations, businesses, etc., all coming together to promote health. Moving on to building healthy public policy. Building healthy public policy is all about the laws and policies that are implemented by governments to ensure that health is improved. These laws and policies can help to create equity in the community, ensure that healthy decisions are easy to make for people, but also to ensure that supportive environments are created for all in the community. The Close the Gap initiative is a great example of building healthy public policy because it's focused on reducing Indigenous disadvantage, reducing the life expectancy, infant mortality gaps, enhancing education for Indigenous people. This is a great example of healthy public policy. Other examples of building healthy public policy include plain packaging and graphic warnings on cigarette packets, which encourage people to make safer decisions or healthier decisions. Some more examples of policies and laws that promote health: the Fresh Tastes at School, Healthy Canteens policy, non-smoking workplaces, the various road safety laws, and also compulsory pediatrics PE lessons. The New South Wales lockout laws is another example of building healthy public policy, which is aimed to reduce drug and alcohol-fueled violence in the community. If you look at this particular graph, you can see that it makes a relationship between the legislation or the policies and the smoking rate over time. And you can see that there has been a fall between 1997 and 2013. Clearly, you can see that legislation can create an environment where healthy decision making is more likely and it can have a big impact.